Hello, my name is Donna Edwards and welcome to Addiction Counselor CEU. Today we're going to be discussing telehealth for treatment of serious mental illness and substance use disorders. Issue brief. Telehealth is the use of telecommunication technologies and electronic information to provide care and facilitate client-provider interactions. It is comprised of two forms. The first one is a two-way, synchronous, interactive client-provider communication through audio and video equipment, also referred to as telemedicine. The second one is an asynchronous client-provider interactions using various forms of technology, further described in this chart below. Here is the guide framework. We have the scope, we have the treatments, and we have the evidence review. Serious mental illness, SMI, is defined as a mental, behavioral, or emotional disorder among adults aged 18 or older resulting in serious functional impairment, which substantially interferes with or limits one or more major life activities. Substance use disorders, SUD, is a diagnosis that applies when the recurrent use of alcohol or drugs causes clinically significant impairment, including health problems, disability, and failure to meet major responsibilities at work, school, or home. Co-occurring disorders, COD, refers to the coexistence of both a substance use and a mental disorder. Take a look at this chart. We have timing, we have application, and we have the technology options for the asynchronous and synchronous. This chart gives you a visual of telehealth, which is an approach that connects clients and providers in multiple locations. You see from the clinic to home, clinic to clinic, home to home, and clinic to the community. Example given, private location or homeless shelter. The benefits of telehealth are telehealth supports team-based care and its interrelated care objectives. A quadruple aim is a conceptual framework to understand, measure, and optimize health system performance. The quadruple aim organizes benefits of telehealth into four categories. It improves provider experience, improves client experience, improves population health, and it decreases the cost. Provider experience may improve the quality of care they may provide and experience the following benefits from implementing telehealth methods. Provision of timely client care. Providers may have increased flexibility in appointment setting by using telehealth. They can extend care beyond a clinic's normal operating hours and its four walls and leverage the virtual walk-in visits. Increased flexibility can help clinics to more effectively manage client no-shows and cancellations. It also provides an effective and efficient coordination of care. An estimated 40 to 60% of civilian clients, not inclusive of military populations, with the mental and substance use disorders are currently treated in primary care offices rather than specialty care settings. Providers can use telehealth methods for teleconsultation, telesupervision, and teleeducation to coordinate, integrate, and improve care. Example given, through the hub and spoke model. There is also a reduction in workforce shortages. This is especially true for underserved and rural areas. It also has the ability to access clients' home environments. Rather than rely on the client's report of their home and living conditions, telehealth makes it possible for providers to see with appropriate permission inside a client's home, meet family support systems, and determine if an in-person visit at a person's home is needed. Ability to share information for psychoeducation and assessment. Psychoeducation, or didactic communication of information to the client about the therapeutic intervention or diagnosis, can be done through screen sharing, thus allowing the clinician to seamlessly display videos, slideshows, or other visuals to the client. Mental health and substance use assessments can also be done this way, allowing the clinician to track the client's responses in real time. Efficient connections to crisis services. In emergencies, telehealth providers can instruct clients to call emergency response systems. Example given, 911 or 988, while the providers remain connected via telephone or video. Enhanced 911 emergency calls automatically provides emergency dispatchers with the location of the client, rather than the client needing to provide their address to the dispatcher. Reduction in provider burnout. Provider burnout is a pervasive issue in the healthcare field and exacerbated by numerous factors, including time pressures, fast-paced environments, family responsibilities, and time-consuming documentation. Telehealth may lead to reductions in provider stress and burnout through promoting more manageable schedules, greater flexibility, and reductions in commute time. The second one is the client experience. Clients may experience many benefits receiving mental health and substance use treatment by telehealth. It increases access to experienced providers and high-quality care. Through telehealth, clients can access experienced providers that may be geographically distant from their homes. Through telehealth modalities, clients can access providers with expertise in their particular conditions and treatment plans that can provide care appropriate for their culture, race, gender, sexual orientation, and lived experience. Improve access and continuity of care. Telehealth provides a mechanism to increase access to quality care and reduction travel costs for clients, increasing the likelihood that clients will see their provider regularly and attend scheduled appointments. Increased convenience that removes traditional barriers to care, including geographic barriers, example given, transportation and distance to providers. Telehealth increases the opportunity for individuals in remote locations to access the care they need. Psychological barriers. Clients who experience anxiety about leaving their homes to access treatment, example given, clients experiencing panic disorders or agoraphobia are able to receive care in a safe environment. Accessibility. Individuals with physical, visual, or hearing impairments and clients who are isolated, such as older adults or incarcerated, are able to access needed health care through the use of telehealth. Employment. The use of telehealth allows clients to receive care while not requiring them to take significant leave from employment or other essential activities. Child care and caregiver responsibilities. Receiving home-based telehealth can help to reduce the burden of finding child care. For family caregivers, telehealth technologies such as remote monitoring can relieve some caregivers' responsibilities, thereby decreasing stress and improving quality of life. Team-based services and group-based interventions. Team-based and coordinated care is critical in high-quality client treatment. However, geographic distances between providers and clients can limit communication. Telehealth enhances team-based care across geographic barriers by remotely connecting multiple providers with the client, promoting provider collaboration and the exchange of health information. Similarly, telehealth improves access to group-based interventions, which demonstrate similar treatment outcomes as in-person groups. Reduction in stigma associated with experiencing SMI and SUD and accessing treatments. Through telehealth, clients can disclose their SUD and/or SMI from the privacy of their own home. In rural communities with fewer behavioral health providers, telehealth can connect clients with providers in other geographic locations, which can increase their privacy and protect their autonomy when accessing care. Satisfaction with care consists with an in-person treatment, despite some initial client hesitancy towards using telehealth. Clients often report comparable satisfaction between telehealth and in-person care. Population health. Treatments delivered through telehealth have been shown to improve health outcomes, including improved quality of life and access in healthcare. For people experiencing SMI, telehealth has the potential to improve quality of life and general mental health, reduce depression symptoms, build more confidence in managing depression, and increase satisfaction with mental health and coping skills when compared to treatment offered in person only. For people experiencing SUD, treatment delivered through telehealth have resulted in reductions in alcohol consumption, increased tobacco cessation, and increased engagement and retention in opiate use disorder treatment. Let's talk about the cost. In rural communities in particular, implementing telehealth services reduces organizational costs by replacing the budget for a full-time on-site behavioral health provider with as-needed hourly fees. Let's take a look at this chart with internet access. 90% of U.S. adults use the internet. 73% of U.S. adults have home broadband. Computer and tablet access. 74% of U.S. adults own a desktop or computer. 52% of U.S. adults own a tablet computer. With cell phones, 96% of U.S. adults own a cell phone. Implementation of telehealth. While the use of telehealth as mode of service delivery is increasing, providers, clients, and healthcare settings continue to experience challenges related to adopt and implementation. For example, uptake of telehealth can be hindered by disparities in access to appropriate and needed technology. The individual client and provider increasing access to and comfort using telehealth. The interpersonal client-provider relationships, preparing clients to use telehealth, building a therapeutic relationship, and the organizational, assessing organizational needs, increasing organizational readiness and workforce capacity to participate in telehealth, and ensuring security and confidentiality, regulatory and reimbursement environments, complying with federal, state, and local regulations. Recent advantages in technology and access to personal computing devices and mobile phones have led to a rapid increase in the application of telehealth across the continuum of care. Example, assessment, treatment, medication management, monitoring recovery supports. Both providers and clients need access to appropriate technology to benefit from synchronous and asynchronous telehealth. Practitioners can provide synchronous SMI and SUD treatments through relatively low tech options, including telephones, smartphones, tablets, and laptops. The age, usability, and functionality of clients' devices may inhibit their use. Example given: ability to utilize various health applications, appropriate data plans. Additionally, clients may be sharing devices with family members or others in the household, limiting the types of data a client would want to store or share through a device. For providers, some clinics struggle to have enough laptops to support staff working from home or outside of typical shared office space, and may not have updated devices or software systems to utilize available telehealth applications. The future of telehealth. The use of telehealth has increased substantially in recent years and has accelerated rapidly with the COVID-19 pandemic. While the landscape of telehealth is continually evolving, the provider, client, population, and cost benefits are emerging. The practices and programs included have demonstrated efficiency in improving client mental health and SUD outcomes in multiple settings and contexts.